and family sport. And I have to do my own work as well, but we have somebody else helping us. And she's very qualified. As you see, she got a long qualification list, and you listen to her. And she's Doctor of Pharmacy at the University of British Columbia in 2020 and completed a clinic pharmacy residency in Lower Mainland. And she has been working and cooperating with us. And we are very happy to introduce that she's helping us and she's moving forward. And now I welcome Harleen Chohan to provide her presentation and explain what else we can do and what other services are available. Good morning. Welcome, everyone. My name is Harleen Chohan. I'm clinical pharmacist, but today my role is to tell you something else and focus your attention to something else. My presentation today is optimizing self-management and family sport. We have so many speakers, they're talking about so many different things. But I also wish to explain there are so many resources and our healthcare system is changing. And how do we change ourselves and improve our health based on that? First of all, we'll talk about digital health. You must have seen that our health system has changed so much. There's so much stuff available online. You might have heard of digital health. If you can check your lab results online, and please raise your hand. Some people know about Health Gateway, where they can review their health results, and you can using digital health. And if you have used your phone to track your physical activity or how many steps you've taken and how much time you spent sitting and how much exercise you did and the conditions and different heartbeat goes up or down, you can track that. And if you have used internet about what is diabetes, and that is also called digital health, you can use we are using so much digital health. Digital health is very important for us. I know sometimes we are tired and we don't see, and why do we use the computer? Why should we use it? We can go to our doctor. But I wish to tell you today, there are so many services are now available on digital health, even access to your doctor. There are so many different patients. They can know how to use digital health. But we know in our community there's a big gap that we don't use the technology that much because we are scared that what are we linking to, what are we doing. People who are watching presentation and it's asking me to open an app, is it safe? And I'm working using this app, and it's a really big issue in our community. How can I use digital health and not? And there's so many different things that you might have used digital health if you have used internet. You done any FaceTime, family members, and you have looked online. If you don't know how to make something, you looked at a recipe online, or you did some online banking. Internet is changing everything these days. So how can digital tools help me manage my health? If your blood pressure's gone up, how can you use digital health to your advantage? And how many people have computer or tablets at home or smartphone? Can you show me? Can you raise your hand and show it to me? And how many times have you used it for your health? There's so many people who did. Now I want to explain a little bit more to you and how you can use it. We talked about lab results, and I'm really happy that people have used it. You can even see your doctor over the phone. You can make your appointments or track your appointments, and you need your video call. And as you said, doing your exercise, you can track it on your phone. And if you have Apple phone, e-health or my health, you can write anything there. If you have Android phone, Samsung, it has a health app. You can enter everything there. Why do we use digital health? First of all, it saves so much time. We go to doctor's office so many times, hospital, we have to wait so much long. But with digital health, you can see your doctor from home. You don't need to go there if your doctor is far away. And sometimes family doctor is not available or you don't have a family doctor. You can see a family doctor online and rest. And if you are sitting at home as we talk today, if you have any problem that's just starting, you have cut or any other issues, and you think you need to see a doctor, you don't need to wait. And if you're thinking you're getting doctor's appointment 4, 5, 6 weeks away, and you want to see your doctor right away, you can access it through digital health. It's easily accessible, and we all have smartphones, computers. You can use all those. And sometimes, some patients are immunocompromised, like cancer patients. They could have health risk. If they go to hospital, they could face other problems. So with digital health, they can safely visit and see a doctor. And what can be done through digital health about diabetes? And we can monitor our medication on the phone if you go outside. And all of a sudden you need to go to the hospital or the doctor. If you have all your medication list on your phone, what medication you're taking, what dose are you taking, how many times you're taking in a day. If you have all that list there, you can easily access it and show it to the hospital. And you can go to your doctor, show it to your doctor, to pharmacist, even if you're traveling, like going to India. And if you lose your medication, if you have the list, and if you have that list on you, you can get those medications. And sometimes the doctors say to you, and other experts, to you monitor your blood pressure. You can monitor your blood sugar levels. You can use that on the phone. What was your sugar level before eating? What was it afterward? How much it increased? You can continue all that. And you did 1 or 2 days readings, and you went to the doctor or physician, so you can take it to the physician. Yeah, or if you don't take it to the practitioner, they don't know what your readings are. If you have it on your phone, the record on your phone, you can show it to them. And this is my 4 week record, and this was my sugar levels, and you can see it yourself. And morning sugar is fine. Some people say that afternoon sugar is fine, but my evening sugar goes up. Then they know what medication they need to change, what dose they need to change. It's very helpful, and you can use that all through the phone. And if you're getting health appointments, you can put it in your calendar so it can remind you. You can create reminders for that to go to an appointment. And you can also get your health records. And so many times I get this question: if I go to the hospital and saw my doctor or the pharmacist, how do I get my health record? Same place where you see your lab results, you can also get information about your medical appointments. And there's so many reports coming there as well. If you're going to ultrasound and you're getting something else checked, and they have all those. And if they have phone there, you can get all that information there. And there's one more thing: health services, you have all those. You have an app, BC Health Navigator app.
You can put your location in there and you can see it. It will show you everything all the it can also tell you about the wait at the emergency, how long it will take you if you go to the emergency. You can use that app with it's all on your phone. You can, if you are not here, you can listen to us at home, all those things. So today I'm gonna talk something specific. It's called Zoom. I wanna talk about Zoom. So our healthcare provider, they are doing team meetings. They are on Zoom. Sometimes we have a question how we can choose Zoom at home. What is Zoom? Zoom is an application, very simple. You can make a video call. You can see them. You can listen to them. You can use it for family members. It's usually the healthcare providers are using Zoom. There are other things, see me, but we are if we learn with the example of Zoom, the main idea of Zoom is you can apply it to any platform. So we will use the example of Zoom today. So what you need for Zoom? For any app, Zoom is an application. You need a phone, smartphone, or tablet, or laptop, and you need an internet connection, and you need internet browser. What is internet browser? Like Safari, Internet Explorer, Google Chrome, Microsoft Edge. These are all the internet browsers. You can click this app, you type, that will connect it to the internet, and then you need a secure internet connection. It's very important if you want to make health visits. Some things you can connect with public Wi-Fi. If you have an healthcare appointment and if you want your information remain private, so that it shouldn't be shared with anyone, you can only use phone. You use only phone data or secure internet connection at your home. If you are using public computer, public Wi-Fi, there are risks involved, because if you have an healthcare appointment, use your own devices or reliable devices, and you know where you are logging in at least. So we will go to the internet browser and we can access Zoom. So sometimes there is enough time. Usually healthcare provider send you a link for the video call. You will receive a link in your email or on any other platform. You will get a link. You see first, is it a doctor, healthcare provider, or healthcare team, pharmacist? You see who is the sender. Don't open any other link. First see who is the sender, who is sending this message. You will know if you already booked an appointment, is this coming from your doctor's office. So you will know what is happening. Then you click that link. We will give you this example for Zoom. So we will click that link. So for Zoom, you don't need to open an account. If somebody is sending you a link, you can use it with the link. The other platforms are also similar, so you don't have to create an account. You can open it from the link. Sometimes when you click the link, if you have Safari, Chrome, whatever we talked about, it will ask you, do you want to open this link or not? So you click it to open. Then so you have to then to join. Then it will prompt you to join the meeting. So you will see, is sometimes it's very confusing because you can see the screen, but you are not seeing the healthcare provider. Then you get nervous. But sometimes first you have to set your video. If like Zoom gives you two options, are you joining with the video or not? If you if you want to see the health care provider, if you want to show them something, so if there is a lump or something, if some swelling, then you have to turn on the video. So when you turn on the video, it's the same thing like we have the interconnection where you are sitting. It should be a secure environment. If you are sitting at home, if you don't want to hear, if you don't want someone hear you, then you can stay in one room. If your if your children are joining you in this meeting, you can bring them in. But if you are walking outside, or if you are sitting in a cafe, then don't do your healthcare appointments there. Don't do that. Then you once you pick up the video to join, then you can see, you will be able to see the pictures. You can see your pictures, your healthcare provider's picture, your pharmacist or your team. Then you can see them. Sometimes you can see the screen. You can see some symbols. You have to change the sound sometimes. So double check before I talk about other processes. At the you have controls on the bottom. They are controls for your video, for your mic. Sometimes patients, I cannot hear you or you can't hear me. Then at the bottom, they mute your voice. So there is a chat function. You can chat with them. Sometimes your providers can send you the files. They can send you the information with the links. So they can send you the links. Right on your right side, there is a link, and then you can. Sometimes the providers finish the meeting, end the meeting, or you can press a button, leave the meeting. You can press that button. Sometimes you can't reach. There are the waiting rooms. So at that time you cannot see your provider, only the white screen. That means sometimes your providers haven't started the meeting yet. So then at that time, just check the settings of your computer. Don't get tense. Don't worry. Once they will start the meeting, then the meeting will start. It's very simple. So we talked about Zoom today, but if your healthcare provider shows you another video, gives you another video option, another platform, you can do that too. So now we will talk about self-management.
Why is self management important? We talked about so many things today, provided the information by so many healthcare providers. But self management through sport resources is very important. So you can take steps for yourself. You make your own health plan. You're not alone in this. You don't need to do everything by yourself. There's so many resources available. First of all, resources, healthcare team, and as you heard about the speakers of today, there's so many resources you can use at home today, or these days, about awareness if that's what's needed, and you have access to it. First of all, we'll talk about HealthLink BC. It's the 811. It's free of charge, available 24/7. It's open. You can phone 811. You just need to dial 811. And if you dial 811, there's somebody available there. They will ask you why you called. And we use 811 when we have some sort of confusion. We need to know what to do. We need some advice. And we don't know if we should go to the hospital or not. For those issues, you can dial 811. And when you phone 811, they'll get your information and they can connect you further to a registered nurse, to a pharmacist, to a dietitian. 811 it can also book your medical appointments, but it's all done online. As I said earlier about Zoom, so they will use something like that. 811 is available in Panjabi, Hindi, English, and many other languages. And if you want to use other sources 811, you don't need to dial that phone number. You can go to website You can say type healthlinkbc.ca. You can get information about diabetes, and that's all available there. And another source is Diabetes Canada, and it's resources throughout Canada for whole Canada, and there is information available for the patients, and it's available in Panjabi as well. And you can go to Diabetes Canada website. You can click to their website, and you'll get all the information there about what is type 1 diabetes, what's type 2, what diet you need. So you can just go to www.diabetescanada.com, and you can use it at home. And then there are family caregivers of BC. But if you don't have diabetes, but somebody at your home or in your family has diabetes, and you're their healthcare provider, and you can get that information. And you're also working, it's creating so much stress for you. You have to look after everything else. So family caregivers can help. So go to familycaregivers.ca, and you can go to resources, and there are support groups available as well. And I'll just take 2 minutes, 2 minutes and finish this. There's a pain BC. If you have pain anywhere in your body, in your nerves, and if you think when you walked, you have some pain, you can get more resources by going to Pain BC. And Pain BC, there's a health exhibition here today. You can go to them for resources. And then the Self Management BC, it's a program by Victoria University. They have a program how you can self-management diabetes at home, hypertension, how to manage yourself, and you can get more knowledge, skills, confidence. And then there's a Jim Pattison Diabetes Clinic. Harwinder is here. She is attached to Jim Pattison Diabetes Education Clinic. And this is especially connected to the program with the diabetes type 2 program. And only a healthcare provider can refer you to it. You cannot go there directly. And then there's a Fraser Health Virtual Care. And that just started last year. Through this program, 1-800-314-0999. You can talk to a registered nurse, or you can go to their website and chat with them. And there are only a few hours they are open. But it's a Fraser Health specific program that you can use. And City of Surrey is here as well. They have age-friendly seniors program. You can ask them questions. And where do you need to go there? Questions about transportation, which park to go for exercises, and which buildings to go to. They have ramps and access for you. You can ask City of Surrey about these things. And Surrey North Delta Division of Family Practice there as well. You can ask them. If you need family doctor, you can go to them. You can ask them. And Primary Care Network on their website, you can see that as well. And you can ask them questions about that. They're here as well. And Diversity is here as well. And they also help you with computer resources, housing, jobs, language services. And you can go meet them today. And options. And they provide similar information. They can give you information regarding housing, diabetes care, community resources. They are here as well today. PICS, you might have heard about them. They have different programs. They have so many different services. They are here as well. Please visit them as well. You can ask them questions. And lastly, South Asian Health Institute here as well. And this is especially for South Asians and how to improve their health. And you should go visit their booth as well. And you must have heard Gunanak Community Free Kitchen. If you're interested in volunteering with them, they provide different foods. And lastly, Icon, we are always here. You can get information. But thank you very much. And you have helped so much by being here today.